capital that we've had in our own state, with the families that are here tonight from atTAcK Addiction who have lost their sons, and there's so many people that we've lost what they would have given as their gift, to our world had they been with us. So many of us have lost loved ones. I've got a lot of family members in my own family who have faced addiction problems, including opiates. And if you go to the women's prison or the men's prison and you speak to the inmates there, 9 times out of 10, it's a drug and alcohol related offense. And a lot of times it's opiates, and a lot of times they got started from the prescriptions that were in their grandmother's medicine cabinet, and it goes on and on from there. One thing leads to another. So I like the idea of addressing our systemic cultural problems to really figure out how to get on top of this. And I know Jack has seen it firsthand in pretty much every department in state government, between the prisons and the schools, the Health and Social Services Department that Secretary Landgraf has worked so hard with, housing, law enforcement, it just goes on and on. It hits all areas. But the most tragic to me is all the babies that are being born that are addicted. And one of the initiatives Jack has worked on really hard is it's called Delaware Can, which is an initiative to offer women birth control at all levels of health care. And my hope is that that program will help solve the issue of babies being born with addiction problems. So with that, I'd like to introduce our panel. We're going to have a question and answer opportunity. If you have any cards that you've written a question on and you'd like to hand it to David Humes, he's happy to take your questions. He's going to look at them to make sure we're not repeating questions. So go ahead and hand David your cards if you have any. If not, I'll go ahead and introduce our speaker, our panel. First, I'm going to introduce our wonderful Attorney General, Matt Denn, who come on up and sit down as I call your name. Matt was Lieutenant Governor with Jack, and he took office in January of the Attorney General in January of 2015. He's focused on the issue of reducing violent crime in Delaware. He's proposed a plan for more police officers on patrol in the city of Wilmington and legislation to crack down on young people caught with guns, and has also proposed using bank settlement funds for programs addressing crime, along with the root cause issue of addiction, education, re-entry, and housing. He also established a new Office of Civil Rights and Public Trust. He's been a long-time advocate for Delaware's children and a proponent of small businesses. Thank you, Matt. Thank you for being here. Next, I'd like to introduce our wonderful secretary, Rita Landgraf. She's the Secretary of Health and Social Services, and she leads this principal agency charged with keeping Delawareans healthy. And let me tell you, Jack will tell me, she has the hardest job in state government. She's amazing, and handles a budget of more than $1 billion, and has been through a lot, as you can imagine, with all the healthcare changes in our country. She has worked very hard to help solve a lot of the challenges we face around mental health and addiction, and it's not easy, and it's an uphill battle, but you've made progress, and for that we're very, very grateful. Next, I'd like to introduce Dr. Dan Hedrick. He has come all the way from California. Dan is the medical director and co-founder of the Mission Pacific Coast Recovery Program. We thought it would be important to get a treatment perspective up here tonight, and we're very grateful that he's here. He does not maintain a private practice anymore, but instead dedicates all of his time to the care and treatment of patients who are at this Mission Pacific Coast Recovery Program, and he helps with detox, and he also offers some alternative methods of treatment, including acupuncture and counseling and some homeopathic types of strategies, because when people are coming off of opiates, and he's an opiate expert, the brain chemistry is really not, it takes a long time for it to regenerate, and these approaches can help with that process. And last but not least, I want to introduce our wonderful community leader, Don Keister, who is the founder of atTAcK Addiction. Don has worked in the field of education for the past 50 years and is currently the headmaster of Caravel Academy. After the loss of his youngest child to a heroin overdose, Don, along with his wonderful wife Jean and other family members and new friends, formed a nonprofit organization called atTAcK Addiction, and their mission is to spread the word about addiction by educating students and the community, assisting families in their quest for information, and supporting those in recovery. atTAcK Addiction has been the recipient of the Governor's Outstanding Volunteer Service Award, the Heroes of Recovery Award, and the Community-Based Award for Alcohol, Tobacco, and Other Drugs from the American Public Health Association. Don has also serves on the board of directors for the Mental Health Association of Delaware and the Blue Gold All-Star Football Game. And they have made a huge impact in 3 short years with really taking on policy that is shaping the way we handle this terrible challenge in our community. So thank you for all you're doing. Did we have any questions on the cards? Or okay, you do have some question cards for me? Okay, great. I feel like Oprah.
Go, Dave.
This is so much fun. I feel like I'm Oprah or something. This is great. Okay, so I guess I'll take the microphone over here.
Oh, you got one. You got one with a seat.
Oh, okay, great.
So you can take that one too.
Dave Hughes did a fantastic job organizing all this. I made the connection and had Dave take care of everything. He did an amazing job. He thought of everything. Thank you so much.
Okay. Right at the right.
You all hear me?
Oh, yes.
Okay, wonderful. So the first question I would like to pose is to Matt Den, our Attorney General. What objective evidence do we have of the connection between prescription drugs and opioids and the use of heroin and other illegal drugs?
Well, I think it's not really theoretical anymore. The CDC has put out some pretty compelling statistics that show the correlation between use of prescription drugs leading into abuse of prescription drugs and then into heroin. And as Sam mentioned, the cost is, in large part a driving factor. Heroin, for a while has been less expensive than either properly or improperly getting prescription drugs. So if your prescription runs out and you can't get access to the prescription anymore, you're not willing to pay the cost, then heroin is much cheaper, readily available. And again, the correlation now, it's not, I think anecdotally, law enforcement has known it for some time, but now the CDC has put out some numbers that pretty much make it indisputable.
Mm-hmm. And if anybody else has comments they want to add on to the answers, please feel free. The next question I'd like to ask is of Secretary Landgraf. As a public health official, how are you advancing prevention within our state, especially now that addiction is being seen as a disease?
Well, first I would like to say that we're very thankful for the relationship that we do have with law enforcement, because I think, as Sam has indicated, public health, and Dr. Carla Markell is here from our Division of Public Health, has been talking about this for some time, but no one has really been paying attention to the voice of the public health officials. But once law enforcement started to identify addiction as a disease and as a population health issue, we are starting to see more people that are actually investing in this from that disease perspective. And so, in like any disease, what do we want to do as public health officials? We want to prevent it. So we are looking at how do we really get out there in a more concerted effort through our education to really promote that level of prevention. And I agree with Sam that because it has this level of attention and because it is an epidemic, that we are really at that level of a turning point, and to really look at it from the disease that it is, a disease of isolation, and how do we invest as a community, what we call in Delaware, all hands on deck, to really attack this from, just like atTAcK Addiction, in a more prominent way at all levels, but mostly starting with our children and starting with our school system.
Sam, are you seeing this being done well in any community around the country? Have you seen a community take this on and really
Well, yeah, it's a good question, and the truth is, I think it's really too new to say there's one community that's done it all,